Welcome. Hi, everyone. Thank you for joining us today. I am Angela Love-Zaranka, Program Director at Lactation Education Resources.
Hi there, I'm Sekeita Lewis-Johnson. I am a mouthful. It is the Accredited Provider Program Director at Lactation Education Resource. Welcome and thank you for joining us this afternoon, evening, or morning, depending on where you are.
Great. So, Sekeita, we are going to have a wonderful conversation. We're going to provide people with information. And then after that, we're going to answer your questions. And so, on the next slide, we actually show where you can find the interface for the GoToWebinar. And the interface is here. If you are on a desktop or on a laptop, you can take a look at that blue arrow and know where you can actually ask questions. If you are participating today on a mobile device, take a look here at the green arrow and you see it's pointing to that question mark at the bottom. That is where you can find the question box, and you are welcome to use it to chat to us and or ask questions. And just so that you can find where it is, if you could please type in the location where you're participating with us today. As I said, I am Angela Love-Zaranka. I'm the program director. I have worked in both private practice as well as in a hospital setting, working with baby-friendly initiatives, as well as I have worked globally to support folks around the world to create the policies and such that are needed in order to continue to support lactation in different areas around the world. Sekeita, how about you?
Yeah, so I actually have worked as a nurse for over 25 years. I've worked in lactation support for over 20 years. I've been in IBCLC for over 15 years. I've been practicing in the hospital setting as well as teaching as a nurse educator. Yeah, I've done it all. Hospital, community work, all of the things, home visiting, all the things that support lactation and infant feeding.
Thank you. And so, yes, we have other people on the call with us today from LER. One is Julie Grimes, one is Wendy Lawrence from our amazing customer support team. Wendy is a person who can answer any of your questions, and she's going to answer a few of them online, privately to you and or to everyone. So Wendy's going to be answering some of those questions. If you're having any tech issues, Jill is from our amazing tech support team. And so Jill, if you're having any tech issues, Jill's more than happy to take care of it. So, okay, let's go ahead and let's dive in and learn about how to become an IBCLC, and let's have more conversation about what it is to be a lactation consultant. So if you decide to be a lactation consultant, you will join more than 35,000 IBCLCs in over 130 countries and territories around the world. Excuse me, credentialing as a lactation consultant is offered by the International Board Certified Lactation Consultant Commission. Take a look at their website, ibclc-commission.org. They have different regional offices depending on where in the world you work or reside. Review the requirements and pathways to become eligible to take the IBCLC certification exam. What do you need to know? The detailed content outline or exam blueprint is based on a survey of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and chronological stages an IBCLC needs to know in their work. Our courses cover the entire detailed content outline, and they are approved by LARC. That's the organization that evaluates and approves lactation consultant training courses. So now there are a few questions that you want to ask yourself as you are thinking about becoming an IBCLC. The first question is do I have these skills? And if not, where can I get them? Sekeita, go ahead.
Yes, thank you, Angela. So yeah, it might be helpful, like Angela said, to write these things down. When we say skills, one of the things that folks often hear when they hear the word skills is task of actually doing something tangible, something that I can do with my hands. I'm going to talk about some of those things, but I'm really going to talk about a lot of other skills. A whole lot of things that, you know what, you might have to really reflect and think about, and it's okay. I am so sorry about the home phone. I do have a home phone. This happened before. So I'm going to talk about a whole host of skills. And the thing I want you to keep in mind is that you may not have some of these skills, and that's okay. You have time to build on these skills. You have time to even reflect on these skills. But if you don't have these skills, you also want to think about, where will I get these skills? And so it might be helpful to write these down just so that you can reflect on a lot of things that we're going to say today, and then reflect back and develop a concrete plan on how you are going to become an IBCLC. All right, so the first thing I want to talk about, when I talk about skills, I'm going to talk about what makes an IBCLC. And I really, really I get so passionate, and I think some people kind of mistake my passion for something else, but I get really passionate when I talk about competency, and I talk about how critical it is as clinicians, as providers, as lactation support providers, to really be competent and not, sometimes we think about lactation, oh, it's breastfeeding, it's natural, it's that too. But think about this. You're going to see a specialist. Let's say you want to see a heart specialist. You want that heart specialist to really know about the heart, right? You don't want to just go to someone that says, yeah, the heart beats, dun, 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 right? We know that, right? So you really want to be competent. So what is competency? It means that you have the ability, the knowledge, and the skills to do a task or to do something successfully, right? And so when we typically talk about care of any sorts, especially when you're just entering the field, we usually talk about you're entering as a novice, right? You're entering as a novice, as someone who has the entry level knowledge to really provide safe, competent care. But it also means the more that you practice, you're going to be exposed to many situations that you may not have been exposed to prior to. So where do you get the skills? So you're going to have the foundational knowledge, but you also have to incorporate your lived experience that's going to build your competency, as well as knowing where to get resources. So at the end of your training, you want to be confident that you are really doing no harm, right? You want to be an expert in the field. You want to be providing care that is quality, that is safe, that you're just not recommending things based on your own experience, because that is not competency. All right, moving on to culturally appropriate and credible care. I really like to unpack what I mean about appropriate, and sometimes you will hear the word culturally competent, which you'll still hear those words if you work in healthcare or been around anyone in the business sectors. You might have heard this. When I think about competency, sometimes it's like, can you really be competent in someone else's, culture? I don't know. That's a question that you might have to ask for yourself. But I think we need to be really clear that when we're talking about language and we're talking about how we incorporate language into our practice, we want to use terms that make sense. And so really culturally appropriate being culturally appropriate in essence mean that you really do a reflection of your own personal background, your own cultural beliefs, which is really cultural humility, right? So being culturally appropriate starts with this sense of humility, where we are really self-reflecting. There's a lot of self-critique that goes on, and it is lifelong. It doesn't stop. Where we're really just not learning about other people's cultures, but we're learning about ourselves, our cultures, our subcultures. So it really starts with an examination of ourselves. And there are multiple definitions that you can find about cultural humility. And if you work in healthcare, you might have heard this before. But when we're thinking about cultural humility, one of the things that, I always use an example is I've heard, particularly in lactation, folks will say, oh, this culture usually don't breastfeed, or this culture waits for a couple days. They usually do this first. And it's very important. We want to refrain from saying this culture does this and this culture does that, because really, like I just alluded to, there are subcultures within cultures. And so the first part of cultural humility is not really feeding into stereotypes, not making assumptions about what people will or will not do based on their culture, because in essence, we really don't know unless we're told, this individual prefers this, or would like to do this, or would like to explore that. And I hope that makes sense. Being credible. Are you a credible resource? When you're asked a question, do you usually go off a whim and just respond off the first thing that go in your head if you don't know the answer? Or do you say, hold up, let me get back to you. I need to go find out the answer to this question. And I'm asking this because a lot of times, most people, when we talk about lactation consulting, anything related to breastfeeding and chest feeding, folks want to tell you their story, right? Their story. Oh, it didn't hurt me. Oh, it hurt real bad. We can always incorporate our experiences sometimes into clinical situations, but being a credible resource means that you're giving out information that A, coincides with the best evidence, and B, you really know what you're talking about. Then the question becomes, you know what? If you don't, then you know where to go and get the resource. And credibility really is everything in any profession. And I'm going to say this as it relates to lactation, because I've seen a lot of things, particularly because social media can run rampant. I've seen actual consultants say things that are not very credible. And so don't be that person, right? Because if you lose credibility, what that can translate is to the profession losing credibility. So folks may not trust an individual. They may say that IBCLC gave me this information and that was incorrect. That translates to folks not really trusting the profession as a whole. So I just wanted to drop that nugget there. Another thing that we do and what makes us, unique is that we are policy advisors, creators, and advocates. And we actually help to create policies. And that's important to know, because when we're talking about clinical care, anything related to clinical care have policies. And so remember, I said, do you have the skills necessary? Some of you on this call may already be policy creators or may have had policy courses. And if that's your strong suit, then yeah, I'm like, great, because we need you, right? So many policies that are in the works and that have been passed recently related to lactation and breastfeeding and human milk provision. So we just want to make sure that we know that even if that's not our strong suit, we are stakeholders. We are folks that should be sitting at the table, really listening to policies, listening to the language in the policies, because we know that poorly written policies can have unintended negative consequences. So if policy is not your thing, you are a stakeholder. That is another form of policy work. And you should be at the table and listening whenever there's something lactation specific or related that's being discussed. The other thing you want to really, and you probably already know this, like anybody on this call should probably know, the level of advocacy that we do is huge. It's a big part of who we are, which simply is that we publicly support and recommend a particular cause or policy. The cause here is human milk feeding. So if you're not a policy advisor, so to speak, you can be that person advocating for certain policies that really remove barriers to disparities in human milk feeding. All right, becoming a problem solver and researcher. Being a problem solver is about 90% of what we do, because every single family that I know I have encountered have their own list of concerns. And so when we're called for support, it's usually called for some type of problem or issue that a family may be having. So you be mindful about framing problems as a one-size-fits-all framework. One of the things that we've gotten caught up in is the whole notion of evidence-based practice. And sometimes those that have been working in the field, we get so stuck on this is what the evidence shows, right? And we forget that we're talking to individuals who have a whole different framework and lens. And so we really need to problem solve from an individual standpoint, looking at the family's individual needs, their individual concerns. And really that means, what are they sharing with you? And if they're sharing a problem with you, you have to sometimes say, you know what? Let me go back and figure this piece to the puzzle out. And that's part of research as well. You can be a researcher, and there are IBCLCs that are actual researchers with published papers. We need you if that research is your strong suit, but also research entails, understanding that we're not all walking dictionaries, we're not all walking textbooks, that sometimes we do have to take a pause, go back, look at what the research is saying, and then go back to our families to help them solve and to help whatever situation they may be encountering. Skilled lactation care. And when I talk about high-level lactation care, that really is kind of what sets us apart. High-level lactation care is really being able to assist complicated lactation and breastfeeding concerns. And in order to do so, you have to have the skill set. So when we talk about, there's a whole lactation acuity framework that's out here. It has been published since 2011. Some folks kind of skip over the framework a lot of times when they're doing their studies, but it's very important that you understand that is what sets us apart as an IBCLC. So when I say high level, I'm going to give you an example. You know, when we talk about assisting with latch and positioning, sometimes that can be fairly straightforward, fairly uncomplicated. Maybe there's really not a lot of issues. There just needs to be a little bit of correction, versus someone who is in an ICU, who is on a breathing tube or who's intubated on life support, and they shared prior to this situation that they really wanted to be able to lactate and wanted to be able to provide human milk. Are you going to be able to deliver the type of care that's necessary? Are you going to be able to look at this person and say, okay, this is this person's situation, this is this person's medications, whoa, this person, did this person have a brain injury, right? And so it's putting the pieces all together. Are you able to make the connections? And so I know a lot of times when we're thinking about, we're training and we're thinking about, we have to know anatomy and we have to know, things about the brain, and we have to know cranial nerves. Yes, that is important. You do need to know about the brain, right? Because it is really this level of knowledge that sets the IBCLC apart, like being able to handle these complex clinical cases with sound clinical decision making and recommendations that are appropriate for the higher acuity levels of care. And so when we talk about acuity, which is the level necessary, the level of care necessary, we're talking about it from an optimal outcome standpoint, right? And so I'm going to tell you right off, I just talked about the worst case of the worst case. I've only taken care of three intubated clients since over the last 15 years, right, as an IBCLC. So I did give you that, but the point is to understand that it's not just I'm just going to the room, I'm just gonna latch the babies, I'm going from room to room, or I'm going from room to room and I'm gonna spill out all the education that I know to you. That is actually not consulting. I've said this, and some people, it's maybe not a favorable opinion, but this is my opinion. Being a lactation educator is not the same as being a lactation consultant. And so we really want to make sure that we are clear about, that set of skills that's necessary. All right, moving on. One of the things that we found out during the pandemic was that we are essential. We are essential workers. It became a buzzword during the pandemic, but those of us that were working in the field found out that yes, we are essential, because babies were still being born, people were still having children, and families were being discharged home faster than they ever had before. And so, we were facing critical times where we also needed protective equipment to protect ourselves to go into homes, right? So when we think about the pandemic, we think about how promoting and protecting the ability to provide human milk was so critically important during that time. And not just from actual the bonding and the bonding and the family and the things we like to romanticize about nursing and breastfeeding, but also from a public health and prevention standpoint. So yes, we are essential. It's important that we show up when people need us, that we're timely, that we can't just say, oh no, we're in a pandemic now, so when this is over, I can come and help you. You're on your own until then. It's important to recognize we are frontline workers. And so I just want to make that clear that yes, telehealth is a viable way of providing lactation support. We also found that out during the pandemic. But there are sometimes constraints with telehealth. And sometimes with lactation consulting, we can miss some things. It can prohibit us from using certain other senses. And so, there's so many ways to think about telehealth. But what I'm really trying to say is that we are essential and that it is prudent and it is our duty that we show up, that we minimize harm caused to families, that we are accessible, because that is what becoming an IBCLC is all about, is being able to provide accessible care in the time that is needed. All right, trusted collaborative care partner. I love this phrase so much because what it assumes is that we are collaborating with our clients. It assumes we are not the center. You are not the center. You are a part of the decision-making team. You are collaborating, and you always have to remember that it is the families, their goals, their fears, their subjective world that takes precedence over your goals for them. So what I'm saying is that we know that the recommendation for breastfeeding and human milk feeding and chest feeding is exclusive. It's recommended that we do it exclusively for 6 months for optimal health, optimal infant health outcomes, right? We know these things, but it's also important that we still honor, we still talk about them, but we also understand that we are collaborating in partnership and agreement with our clients, that when someone is seeking our help, that we don't overstep the boundaries that they've created for themselves, and that they're boundaries that we're meant to not overstep, right? So that's how we become trusted. That's how we become trusted to do no harm, trusted to be reliable, trusted to say, you know what, I see you as a person. I see you and I'm collaborating to do what's best for you, right? That's how we become trusted. So be careful of going into clinical situations, perhaps when you're being called to assist. The most common situation is we're called to assist with latch. And sometimes folks go in and they're like, yep, I'm the expert. I've been doing this for 15, 20 years. I'm going to show you how to do it. And you just start to touch and move without building rapport, without asking if you can touch, without even asking what type of latch assistance are you really accepting. And so really being trusted to go in before you touch someone, ask for their permission, right? Let them tell you what type of assistance that you need, and try to refrain from going in with the spiel that you give for every single person that you come across. So in essence, when you combine all the things we do, I am talking about person-centered care. I've talked about culture, I've talked about the level of care, the type of care, communication, and collaboration, and the person is at the center of it all. Person-centered care can also be a buzzword if you allow it to be a buzzword in healthcare. But what I'm suggesting is to really look intentionally at this model and really build your skills set, build your foundational knowledge and skills set up on this framework. All right, so I came on with a few questions. I'm going to leave you with a few questions to ask yourself. It's before Angela takes over. She's going to come on and Angela's going to talk about the pathways, and really trying to make sense of all of the pathways can sometimes be overwhelming. But don't be overwhelmed, because we're here. This will be recorded, and so you can go back. But what I want you to consider is, before you start this journey, think about the local market. Maybe do a market analysis about where you are, how many lactation consultants are in your area? Where do they primarily practice at, right? Is it private practice? Is it hospital? Is it in community orgs? Is it at pediatrician's office? Really think about what are some things that you need to look at in your local market. And then you want to look at, how does the study and the clinical hours and perhaps the college courses, how do they fit within my life right now? Like, what are your current commitments? What are your current responsibilities with your family? Take a moment and write these questions down so that, again, you can reflect and kind of like get a temperature for, is it the right time to embark on this journey, or setting a goal for when you will embark on this journey. What does mentorship look like in your area, right? Are there opportunities for you to link up with other lactation providers? What about coalitions? Are you actively involved in local coalitions where folks are talking about some of the issues that are happening in the lactation landscape? So these are all things to think about, reflect about, as Angela gets ready to pop on in and take you away to what does it look like to be on the particular pathways.
Great question, Sekeita. Thanks so much. So the process of becoming an IBCLC may feel a little bit complicated, but I'm going to break it down and give you a roadmap to the IBCLC. Now, we'll touch base on this later in the presentation, but as you're listening, know that you don't have to go out and find each one of these things. LER has ways to help you with each step of the process. So first, you're going to choose a pathway. We'll come back to this in just a moment. Now, each pathway has 3 components. The first one is education, then there's your clinical hours, and then there's getting ready for the exam. Okay, so the first one, the health sciences education. It's the typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find the full list of each of the 14 subjects on the IBCLC Commission website. You can search for it, or you can find a link in the handout, which is in the portal, the GoToWebinar portal. If you'll see there's a little thing there that says handouts. You can go ahead and click on that and download it. So the 8 university level courses are, and you don't need to write these down, biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. If you took any of these courses during your college career, they count, even if it was 20 years ago. LER has a wonderful partnership with Walden University to provide the basic courses. Walden is online, and they've chosen the courses that best fit the Commission's requirements. We've been collaborating with Walden for a while, and they were wonderful supporters of our scholarship this year as well. So thanks to Walden. Now, the 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions and infection control, and basic life support. So 5 of the 6 general ed courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there's an in-person skills check for this training. I've heard some organizations will provide this training completely online, including the skills check, so it's important for you to check with your local resources. The guide provides general descriptions for typical courses in each subject area. Now, please keep in mind that the IBCLC is international. The names used in their document to describe the courses may not exactly fit the description of the course at your accredited educational institution. It's okay. You will note these broad terms with the understanding that there is no universal description for, let's say, what a course in clinical research is going to cover. So why are these 14 courses required? The IBCLC is a standalone credential. meaning you do not need another certification or degree or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared for your career as well as to help you to pass the exam. And so now we're going to talk about another type of education, which is the lactation-specific education. And here we're going to talk about the 90 hours that you need, as well as the 5 hours of communication skills. We've got you covered on this one as well. Remember that education should be comprehensive and cover the detailed content outline. The commission requires at least 90 hours. And now the 5 hours of communication skills, which is different than the college course on communication, the 5 hours that we offer is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. Okay, now, the third thing that we want to talk about are the clinical hours, that lactation-specific experience. This can be done in person in consultations, or over the telephone in consultations, or online. And it can be breastfeeding and lactation care that supports these breastfeeding families. It also includes lactation assistance to pregnant and breastfeeding clients, and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately applying for the exam. So how many hours do you need? That depends on your pathways. Now, as far as the pathways are concerned, these are the clinical hours. The pathways really have to do with the clinical hours, which need to be accrued in the 5 years before you apply for the exam. And here's a quick overview, and I'm going to review them a little bit more deeply in the following slides. So pathway 1 is for health professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Healthcare professionals include physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, La Leche League International, and the Australian Breastfeeding Association. Now, Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both the didactic and the clinical components, and they require 300 clinically supervised hours working with breastfeeding families. Pathway 3 is a structured mentorship between an IBCLC and the applicant. The IBCLC, or there could be more than one, must be in good standing with IBLCE. Those who choose this pathway must have their program pre-approved by IBLCE prior to beginning to accrue their clinical hours. A quick note, for those of you who may have breastfed, chest-fed, or provided human milk for your child, the hours you spent nursing and pumping and helping your friends doesn't count towards your clinical hours. Now, while 500 or 1,000 hours seems like a lot, there's a good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. And I think I can speak for Sekeita that I'm learning something new every day and with every client that I serve. If it's any consolation, the number of hours required used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours. So, candidates who are applying for the IBLCE exam through Pathway 1, focusing on that for a moment, they need 1,000 hours. For the candidate who's also a healthcare provider, those hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBLCE recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. So 2 important points about these clinical hours. It's important for you to document the hours as you accrue them. Be very detailed in case IBLCE chooses to audit your application to take the exam. They may want to see documentation such as a spreadsheet or some other document where you counted your hours. And the second thing to remember about these clinical hours is the 1,000 hours do not need to be directly supervised. Note that LER has a program for those of you who are not already affiliated with a breastfeeding support organization. The LER Hours program offers a great way to gather those 1,000 hours in your community. So now we're going to move to Pathway 3, and that requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with many breastfeeding, chest feeding people and those providing human milk for their babies each day, such as a hospital or a clinic setting. The hours count towards the 500 hours only when you're actually working with families. Observation hours don't count. As you all probably know, clinical experience is graduated, meaning it starts off with observation, then doing tasks under supervision, then completing tasks independently with the IBCLC nearby to ask questions and discuss situations. LER has an internship program with many sites around the US. Reach out to support at lactationtraining.com and we can connect you with our clinical internship director, Amy Black, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. One thing that Amy wanted me to mention today is that you can't start to count your clinical hours towards the internship requirement until both you and the IBCLC feel comfortable with you working independently. Most interns are going to spend about 75 hours in orientation before they can begin to accrue the 500 hours. Or you can take a look in your community to find a willing internship site or mentors. You may need to reach out to many people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 to find those successful strategies and finding a good mentor. Now, while this pathway has an additional step or two, some people will ask, is it worth it? Yeah, it is worth it. And the reason why is because IBCLC reports that students who come through Pathway 3 usually score better on the exam. I think it's that mentorship piece, which is the key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. Now, a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic. The quick answer is yes. The longer answer is paraphrased from IBCLC documents. IBCLC will allow the use of technology if certain parameters are met. You'll need to pay special attention to the privacy rules and the Code of Professional Conduct, as well as the clinical competencies for IBCLCs in order to accrue hours in this way. So now, the lactation-specific education. At LER, there are two ways to gather this education. One is the LCTP, which is known as the Lactation Consultant Training Program, which is the full 95 hours front to back. The other one is Core or Bridge. They are designed to meet your education needs depending on your background and previous lactation training. First, we have a comprehensive course called the Lactation Consultant Training Program, as I said, LCTP. It's a 90-hour course which is eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation education and know they want to become an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including as well me and Sekeita. Our classes are economical and you can view them on a variety of devices such as your computer, tablet, or phone. They're optimized to a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we will update sooner as new evidence emerges. Have a question for the instructor? You can send an email to our support forum and we have IBCLCs available to answer your questions. Want to discuss a concept with your fellow students? We're discussing innovative ways for people to connect. Stay tuned for more information. So now upon completion of the 95-hour course, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you're a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBCLC exam. Now, if you're unsure where to start, or if you already have some lactation-specific education hours, then we have our core and bridge programs to meet your needs. They have the same advantages as LCTP. Our initial course is called the core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52 hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the Certified Breastfeeding Specialist exam. The bridge course is ideal for people who have the basic lactation education components and need an additional 45 hours to qualify for the exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. Now, if you're not sure where to start and you're new to the profession, I would suggest the core course. Get your feet wet and see if becoming an IBCLC fits. Now, I know that these requirements seem like a lot, but we're here to help you every step of the way. If you have questions about the pathways that don't get answered here today, please be sure to reach out to our friendly customer support team. Many on our team are IBCLCs, and they know the process inside and out. LER has 3 ways for you to earn your education, depending on your goals and where you are right now in the process. If you have questions about what would be right for you, again, our customer support team is here to help. Now, if you're not a health professional already, working directly with parents and babies, getting those hours can feel like a challenge. Remember that we have 2 programs to help with that. One is for Pathway 1 and one is for Pathway 3. And when you're ready to sit for the exam, we've got you covered there as well. We offer 2 versions of our very popular exam prep course. Both use the LER Q-Bank system, which is a comprehensive program including practice exams, photo flashcards, anatomy flashcards, a study schedule, and more. For those who take our 95-hour course, we include a discount on your exam prep course. Now, our 90-hour course, as well as core and bridge, are available in Spanish. Capacitación en Lactancia is our website, which provides the same high-quality education found on LER in Spanish. Now, at LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, LER is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize that one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. We alternate these scholarships each year. 2025, we're going to host our Juntos Triunfamos Scholarship. You can find out more information on our website, lactationtraining.com/Rising Tide. And if you'd like to know more about when we will announce the opening of the application, please do sign up for our newsletter or keep an eye on our social media. So we are here to help you now and in the future. We have tech support 7 days a week. Get your questions answered by content experts in the field, and we will provide you with ongoing support for your steps during your lactation journey. You can get your content questions answered by experts in the field, as I mentioned before. Last week we had someone who reached out to us who had a question about their own practice, and I didn't have the answer for it, and someone else didn't. So we reached out to one of the instructors and said, hey, can you help this student out with this question? And they were able to do so, and the student reported back that things went really well for that family. So remember that we are here for you to support you during your journey. Okay, we've provided you with some wonderful information here. And now the question is what questions do you have for us? Sekeita, anything that we need to address?
Yes, let me check it out. I am sure, and thank you, Wendy, for handling the questions so far.
Yes. Thank you,
Actually,
Wendy.
I see one flagged question, and it says, what does a typical day look like for a lactation consultant? I know it depends on the area you are working in, hospital, community clinic, etc. So I can answer how I practiced when I was at a very busy hospital setting. Remember, I mentioned the lactation acuity model. I practiced from an acuity model standpoint, which meant, now you have EMR. So I'm talking about the hospital only. Electronic medical record, where I would go in, I would get a printout of the census and who had orders. So there would be orders for me to see certain clients. But I just didn't
Mm,
rely on the orders. What I did is I also looked at the families who were exclusively feeding. I looked at the infant's weight loss. I looked at if there were any risk factors that the parent may have had for milk supply concerns. I looked at the infant's peas and poops. I mean, I looked at almost everything. So for about an hour, I would spend in the morning looking at every single family, determining who was going to be discharged. And if there was a family that I had a question and that I had some concerns about, I would go touch bases with the nurse and say, hey, I need to see this family before they're discharged home. And then I
mm,
would touch bases. We had rounds every day. I would let the pediatricians know, hey, this family I'm concerned about. So it was a collaborative care model. And that's really how I practiced. So what that meant was that every single family could not be seen and would not be seen,
right.
because when you practice from an acuity based model, it truly is an equity based who needs to be seen, who has the higher level of care, the higher level of needs. And so that's how I practice. It's impossible to see every single family. And that's
Mhm.
why I made the comment earlier about being a lactation educator is different from being a lactation consultant, because there were times at the hospital setting where I had to do a feeding observation. Well, feeding observation looks like me going at the time that the baby is ready to feed and watching that feeding from the beginning to the end. And then I got to go chart on it. And then I have to make sure that I educate on the recommendations. And so it looks different. That's the hospital setting. I think Angela and I practice about the same in the hospital setting. Angela, you want to talk about private practice and community? What does that look like?
So working in private practice in the community, I mean, I can say the phrase "it's feast or famine" is so true. And that there are some times when you're just seeing clients and, oh my goodness, you just feel so overwhelmed. Oh, how am I going to see everybody? Right. And so that's where the collaboration and that's where the conversations that Sekeita mentioned earlier is so important, to have those people that you can that can support you and that you can see. But it depends on if you're working in an outpatient clinic, or if you're doing home visits for people, if that's something which is even an option for you, or if you're doing telehealth visits. So you could see several clients in a day easily, depending on which setting you're in. I've worked in offices. I've also worked as, doing home visits for people, actually, driving around and visiting with people. So I've done both, as well as I've done a lot of phone help. I started out as a peer supporter. And so that was, now I'm going to show my age. That was when we were dealing with everybody over the phone. And so, talking to people, understanding what they needed, running support groups, things like that is all part of it. And then also networking with your colleagues in your community, other healthcare professionals, that's a piece of it as well. So all of those different pieces sort of go into what it looks like to be practicing in the community.
And I just want to add to that. When you figure in your time and what a typical day is, a lot of people forget to figure in
Thank you.
documentation and
Yes.
collaboration.
Yes.
So depending on how you build your practice and depending on where you're practicing at, you do have to include the documentation is a huge part of your day, particularly when you are someone who is individualizing your care plans and not just doing click, 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 click based on EMR systems. And so I won't even continue to go on that, but I will go to the next question. You see any other questions, Angela? That
I
was one.
do. Yeah, there's one here. Does it matter where I engage with the course? if they live outside of the United States. And absolutely, this person is in the UK. We were just in the UK ourselves, letting more people know about our content. We literally have people from all over the world who engage with our content. And what you need is that stable, internet connection in order to engage. And that is something which I know is a challenge, not only around the world, but also in different rural parts of the world. And so indeed, having that access is something which is really important.
Next question. Is it required to be an RN? I have researched jobs and most are saying RN/IBCLC.
That's why I'm smiling so broadly, you see.
So it is not required. The IBCLC is a stand-alone credential. And I am, as a nurse, I'm going to say this boldly, and some of the nurses might, on this call, they might cringe, but that's okay because I stand on what I'm saying. As a nurse educator, nurses nor physicians get courses in clinical management of lactation. We have to do the same 14 courses, health science courses that allows us to move on to our clinical courses. Same courses you will have to do that will allow you to start to move on to get your clinical hours to become a lactation consultant. The IBCLC credential is standalone. The whole RN IBCLC thing is very controversial. And I am going to leave it there.
Great, Sekeita. And that's one of the reasons why Sekeita and I, collaborate together and provide this content. I work exclusively as an IBCLC. I've been doing this work for over 30 years. I have had the privilege of serving families in a variety of settings. I adore this. And does it mean that there are some doors which are closed to me because, a specific employer requires a second piece of it? Sure. And so that's why it's important to do this homework in advance, right? So that you know what it looks like for you to, whether or not you can, support yourself and sustain yourself and thrive. If you choose to become an IBCLC, do the homework first and then find out. And I have gone to many hospital systems, either as a consultant or as someone who, is sort of looking for that opportunity. And I have educated hospital administrators. And one of the, sometimes a question I'll ask is well, do your speech pathologists, are they all nurses? No? Oh, well, what about your physical therapists? Are they nurses? Oh, no? Right? So just to give them something to ponder and think about that. And I also have documentation, right? Our professional associations, the International Lactation Consultant Association, the United States Lactation Consultant Association, the European Lactation Consultant Association, all organizations have these seminal documents which you can utilize and take to a potential employer and let them know, hey, this is what an IBCLC does. This shows the importance of the IBCLC. Can we have a conversation about this and find out how I can fit into your system and provide the best care possible for families? So,
yeah, I do want to add too, Angela, that I have been influential in getting that changed at a hospital that I worked at. And went directly to our director because I am aware that hospitals do hire folks that do not have an RN attached, and they are IBCLCs, and they still get hired somehow. And so I was able to have that changed. And while I was there, we did hire 2 IBCLCs that were standing alone on their own credential and on their own merits and on their own qualifications and expertise. And so the more we talk about this being a standalone credential and reducing the barriers for people who can really do the work and who are credentialed to do the work, the better we will become. But I am seeing some places remove that as a barrier. And so I want to say that. So thank you, Angela, for lifting that up. There's another question I want to move to. It says, what advice would you give a male going into this who is also a doula, it being not so normal having men in these intimate settings? I know a few men who are IBCLCs, and so one very influential that I can call a friend. But what I would say is don't let your gender stop you from doing this work. And so very important to have everyone who really understands clinical management. And I just want to speak on my friend who shared this experience of when the pandemic hit, how, someone came knocking at his door because they knew that he could help them in a rural setting. And so don't minimize, I'm saying come on, because it's rare but so needed. And I really just want to say thank you for asking this question, because sometimes people shy away because of that. But no, you're absolutely needed and wanted.
Absolutely, I agree. So now, Sekeita, we were talking about nurses. You see the next question. Would becoming an RN increase my chances to work as an IBCLC in the hospital? So I'll start.
Okay.
That is something that I have considered like my whole career. And I have finally, about 10 years ago, I put it to rest. And the reason why is because I do have the skills. I have the knowledge. I know what I have. And I also see that as, since the pandemic, we have an incredible nursing shortage. And we don't have enough skilled folks providing nursing care. And so then to require a dual credential or license is something which I think is a bit too onerous. And so I think that this may be that opportunity where things are going to begin to shift for the standalone IBCLCs to be recognized and to be provided with a well-paying job, not just a small job, but a well-paying job. So, commiserate to the colleagues that they work with in a hospital setting. So I think it's up to each individual person to decide whether or not to do that. But that was part of my journey. Anything to add, Sekeita?
Having gone through nursing programs and having been a nursing educator at a college, if you become an RN only if you want to become an RN. If you're feeling like this will increase your chance to work as an IBCLC in the hospital setting, I would say that there are probably other ways to make that happen. Again, I know I have a few friends who are not RNs who are IBCLCs in the hospital setting. The RN program itself, think about this. You will have to do clinical hours in geriatrics. You will have to do clinical hours in medical surgical. You will have to do clinical hours in pediatrics. You will have to do all kinds of clinical hours, but guess what? None of those clinical hours will be able to be put towards your IBCLC. So
Fair.
folks think that RNs, and I'm gonna just, this has been weighing on my heart, but this is called the realities. People think what I want to say, what is fact-based, because I want to say with fact. RNs do not get clinical management of lactation in any college program across the United States. I can say that here in the United States. I'm not sure internationally what's happening, but I can say it's not built into the curriculum of physicians nor RNs. Pediatric residents are now, and was probably the first to start to have a framework, and that just happened maybe a few years ago, where the American Academy of Pediatrics found the importance of incorporating some type of curriculum for lactation for their pediatric residents. That's post-medical school. So when we think about the whole rationale of why would it be an RN required to work in the hospital, it is beyond me. It is beyond me, because we do not get any clinical management courses of lactation. And I'm very clear on what I'm saying. So I just want you to know that if you want to become an RN, I support you become an RN because you want to become an RN, but not because you want to increase your chances, because you won't be working towards an IBCLC at that point. You won't be getting any clinical hours. There's that. Angela?
Perfect. Thank you. That's lovely. Yes, next question. So this person is an RN with NICU experience, currently in postpartum mother-baby unit and also continuing in the NICU. So they're very involved with a lot of, breastfeeding mothers working with full-term and premature newborns. Which route is best for me to take?
Yeah. I'm personally going to share that I did, as an RN with a lot of experience, I did pathway 3 because I wanted to really have the knowledge and I wanted a mentor. And I ended up having several mentors, but I really wanted to do the hours necessary so that I could only focus on lactation and clinical management from outpatient, inpatient. And so I chose that route. You could choose pathway 1. Um, and there's a calculator on the website for you to be able to determine how many clinical hours you can use based on your work. So yeah, I mean, you could do either or, pathway 3 or pathway 1.
Good. So this one is great. I like this, and I think I have an answer for this. So this person says, why do a lot of mentors shy away from being chief mentors in pathway 3? They work at a hospital in a large metropolitan area, and there are IBCLCs that are willing to mentor this person and have been working with this person, but struggling to find a chief mentor. Well, I have a great idea, and that is that we can be your chief mentor if you come through our Pathway 3 clinical internship program. Reach out to us at support@lactationtraining.com. To be fully transparent, there is a fee associated with it. But if you already have the mentors and all you need is a chief mentor, then I have a feeling that Amy would love to chat with you about creating that program. So Amy is our clinical internship director and also serves as the chief mentor for individuals who want to become an IBCLC and utilize Pathway 3 to accrue their clinical hours. So that is it. And I'm curious to this person who asked this question, what if the IBCLC said? In other words, why are they shying away from it? And sometimes they just don't know what's involved. And I'm assuming that you've educated them, but Amy may be able to help you with some of that information as well.
Yeah, that's a great response, Angela. I actually see one more at the very, I think Wendy answered that. As a doula, would pathway 3 be a good choice? I would like to add lactation consulting to my skill set. As a doula, pathway 3 could be a good choice. Pathway 2 could be a good choice. It just depends on, what college courses you may have or may not have, or, I don't want to assume that because you're a doula that you don't have any other credentials. I don't want to make that assumption. So, but you could do, essentially any of the pathways. If you linked up with a breastfeeding support organization like LER and went through the certified breastfeeding specialist, you could do pathway 1. I am also a birth doula, and that's why I said what I said, is that I don't want to make the assumption that there's no other experience outside of being a birth doula, but essentially you could do, just depends on, what you have as far as college courses already and what you need as far as your learning needs and clinical hours, and how do you want to get there? What does your journey look like?
Thank you. Well, and there's several questions about the college courses, and they want to know whether or not, the college courses, if someone can take a look at their transcripts and see if they match. Really that's something that you need to do. IBCLC doesn't do that. We don't do that because we don't want to give you incorrect information. However, if you take a look at the Health Sciences Guide and compare it to the class that you took, even, if it was 20 years ago, you do want to, take a look at it yourself and see if it relatively closely matches sort of how they describe it in the Commission's guidebook. Then it's something that probably will count, and you do not need to retake those college level courses such as anatomy and physiology. That's something where if you took it a while ago, it's just fine and you can go ahead and count it. Anything else, Sekeita?
I think that's it. Wendy has been fabulous in answering the majority of the questions. And so I don't see any more that have been flagged for us to answer. I think they
Great.
have great questions. And yeah, I think that's it.
Excellent. Good. Well, thank you all for joining us today. This has been fun. It's been quite a pleasure. So please do reach out to us if you have any other questions.
Yes, thank you. Enjoy the rest of your morning, afternoon, or evening or night. Bye.
Bye, everybody.